Hi, I'm Becca and welcome back to Mental Health Mondays. First, in reference to last week, I want to make it clear that everyone can experience anxiety at some point in their life. I just wanted you to know the difference between anxiety and fear, and that anxiety is more internal, as you can't always specify what you're anxious about, and again, it's in reference to that vague sense of threat or danger. And just because someone experiences anxiety at some point in their life doesn't mean that they will experience an anxiety disorder. An anxiety disorder differs in that it involves anxiety that is more intense, lasts longer, it can last for months or longer instead of going away after a stressful situation has passed, or it can lead to phobias that interfere with your life. I hope that makes sense. So now we're going to start going into specific anxiety disorders, and I'm again going to be using my Abnormal Psych textbook and also this anxiety and phobia workbook. I got it on Amazon. If you just search anxiety workbook on Amazon, it's the first thing that comes up, and it's really helpful. It does a lot of explaining of different anxiety disorders and gives you tips on ways to deal with it. This week, I'm going to talk about generalized anxiety disorder, also known as GAD, which is what I'll be referring to it as for the rest of this video, so I don't have to keep saying generalized anxiety disorder. So GAD is characterized by chronic anxiety that persists for at least 6 months. You experience excessive anxiety under most circumstances and worry about practically anything, which is sometimes described as free-floating anxiety. Someone who has GAD has a large number of worries, spends a lot of their time worrying, and finds it hard to gain control over these worries. The intensity and frequency of the worry is out of proportion to the actual likelihood of the feared events happening. In addition to this, to be given a diagnosis of GAD, you must have at least 3 of the following 6 symptoms, where these symptoms are present more days than not over the past 6 months. These symptoms include tension, being easily fatigued, difficulty concentrating, irritability, muscle tightness, and difficulties with sleep. There are no specific phobias associated with GAD, but there's one view suggested by Aaron Beck and Gary Emery that states that this disorder is sustained by basic fears of a broader nature than specific phobias. That includes the fear of losing control, fear of not being able to cope, fear of failure, fear of rejection or abandonment, and fear of death or disease. These are very vague symptoms, and some of these things can be due to physical problems or can be attributed to another disorder. So if you think this sounds like you at all, I strongly encourage you to find a professional in your area that can give you a proper diagnosis. This disorder is very common, so what causes it? Although the causes are still unknown, it's likely to involve some combination of heredity, neurobiology, so just chemicals in your brain, and certain childhood experiences, including excessive parental expectations, parental abandonment and rejection, or parents modeling worry behavior. There's a range of treatment out there, including relaxation training, cognitive therapy, worry exposure, reducing worry behaviors, problem solving, distraction, medication, mindfulness practice, and lifestyle and personality changes. And again, this is just some of the treatments right now. I'm sure as there's more research done and stuff, there will be more. We will go deeper into these treatments when we start talking about therapy, but I mention all these treatment options to give you some hope if you're struggling with this, because just because one thing doesn't help doesn't mean nothing will. And even if one medication doesn't work, it doesn't mean another medication won't. If one type of therapy doesn't work, it doesn't mean another therapy won't work. And I know it can be frustrating and hard and it takes time, but I know you can find something that will work for you. I'll leave you with one breathing exercise that I have found helpful. It is described in this anxiety and phobia workbook. So first, become aware of the level of tension that you are feeling, and then you place one hand on your abdomen, so like right below your rib cage, because this is where you want to like feel your breath. Inhale deeply through your nose to the bottom of your lungs for 5 seconds. Then pause and hold your breath for 5 seconds. Then exhale slowly through your nose or mouth for 5 seconds, or more if it takes longer to fully exhale. Then take 2 breaths in your normal rhythm, and then repeat the exercise. Continue this breathing exercise for about 5 minutes, and try to do this daily, because that's when you'll start to see changes, and like that'll become your normal breathing pattern. This can be helpful for anyone, whether you are dealing with an anxiety disorder or not. Breathing is incredibly important, and it's easy for it to become shallow and rapid when feeling tense. Like always, I'm going to end by saying something I'm grateful for today. I'm grateful for my education. I learn more and more every day, and that's allowing me to make these videos and follow my passion to hopefully become a mental health professional in some way, which I just think is really cool. This week's quote is, "Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all which can have the potential to turn a life around." As always, continue to practice compassion and kindness in your everyday life, and your small act of kindness may be just what someone needs. Remember, you are not alone. I will always be here for you. If you have any questions, comments, or concerns, you can comment below or send me a message using the email in the description. I hope you have a wonderful day, and I'll see you next week.